Hello, my name is Jim Kennedy. I'm a GP in Wargrave and Joint Clinical Director of Wokingham North Primary Care Network. And I'd like to talk to you today about the Hot Home Visiting Service. This is a service specifically set up in Wokingham and in Berkshire West to look after COVID probable or confirmed cases that need a home visit. The vast majority of these are going to be in nursing homes. So to give you an idea of the problem, we have 51 nursing homes across Berkshire West. They have over 2,500 residents in there. Two-thirds of those nursing homes already have COVID-19 within them, and it's anticipated that many of the rest of the nursing homes will potentially succumb over time. As you can imagine, COVID-19 in a nursing home is not a good mix, and significant numbers of patients can be affected very quickly. At the same time, a large number of staff can be affected in the home, so when they most need the staff, they have less staff available. The response to COVID-19 in homes is being very ably coordinated and led by the practices that have registered patients in those homes, and in particularly well supported by the Rapid Response and Treatment Team, more commonly called the RAT team, who provide care and community nursing to the residents of homes, which is very ably led by Dr. Leila Salhani-Matt. Now, they are at capacity at the moment. There is a real need to have GPs assessing physically some of these patients in the homes, and therefore we're setting up this home hot visiting service to go in and provide that. It's will have three very important characteristics. The first is there's very, very good PPE and processes in there. The second is we seek volunteers who are GPs or practice nurses who are prepared to go in and do shifts in this service, working alongside the RATS team. The third thing is that ideally you would have significant experience and capability in handling elderly people with polymorbidity, polypathology, and quite complex. It's a very rewarding but challenging role because you have very complex patients that you're trying to determine are their symptoms due to COVID or to non-COVID, and what is their best management. It will entail not only examining patients and coming up with treatment plans, but working with colleagues in the RAT service and with paramedics and ambulance service colleagues. It will require liaison occasionally with consultant colleagues, and it will require very regular communications with the patients' registered GPs and their practices. You can do huge good in this. Not everyone who gets ill in a nursing home is COVID-19, and we need to be able to differentiate those who have other treatable causes versus COVID-19, and then manage the both sets of problems, but especially the COVID-19, in as sensible a way as we possibly can. We've had some very good successes in managing and treating these patients to date, but obviously many of them are very frail and do unfortunately succumb to COVID-19. Over time, this service will also be offering support to patients who are receiving care in their own homes who may need assessment for possible COVID-19. And eventually it will also stretch out to cover learning disability and neurological disability homes, of which there are 20 or 30 across Berkshire West, if or when they are affected by possible COVID. We're keeping this planned to run for May and into June in the first instance, but we will be making regular assessments of whether there's an ongoing need for this service. But certainly at the moment there is a need So we invite you to sign up for sessions. Sessions last from about 9:30 to about 6:30. They are very well supported with senior direction from Dr. Leila Salani-Mat and from myself. So there's always someone to support you. There's excellent support from the RATS team and the nurses within the RATS team and other professionals within that team. And you have access to Toughbook computers from Westcall and Westcall vehicles, which in this case are high-top transit vans that not only have all the kit we require for the service, but to have an area within the van where one can safely don and doff PPE before going into the homes. So I strongly invite you to look into the service. I'm very happy to have a conversation with anyone, as are my colleagues. And at the end of this video, we will put up the contact details for how to contact us. So I hope we will see you at some stage in the future, and I hope you will be working in the service. Thank you.